8 urgent signs that your body is in need of more vitamin B12. Have you ever felt unexplained tiredness, even after a good night's sleep? Have you ever noticed sudden changes in your mood or difficulty concentrating? What if I told you that these symptoms could be linked to a silent deficiency that affects millions of people around the world? Vitamin B12 is one of the most essential nutrients for your body's functioning. It participates in the formation of red blood cells, the functioning of the brain, and even the production of DNA. However, many people are disabled without even realizing it. What's worse is that the signs of this deficiency can be subtle at first, but over time, they can lead to serious health problems. Therefore, understanding the symptoms and knowing how to prevent them can be the key to avoiding complications. Today, you'll discover the 8 urgent signs that your body may be screaming for more vitamin B12. Let's get started. What does vitamin B12 do in your body, and why is it so important? Vitamin B12 is one of the most essential nutrients for the functioning of the body. It plays a key role in the production of red blood cells, ensuring that oxygen is transported around the body efficiently. In addition, it is indispensable for the maintenance of the nervous system, protecting neurons and preventing damage that can lead to symptoms such as tingling, muscle weakness, and memory loss. Another crucial factor is the participation of B12 in DNA synthesis and cell division, fundamental processes for the renewal of body tissues. Without adequate levels of this vitamin, the body begins to fail, causing everything from extreme fatigue to cardiovascular and neurological complications. Even though it is vital, many people do not give proper attention to vitamin B12 until the symptoms of its deficiency become severe. Therefore, understanding its importance is the first step to ensuring balanced health. The hidden danger. Why are millions of people disabled without knowing it? Vitamin B12 deficiency is more common than you might think, and worse, many people spend years without knowing that they are suffering from this problem. This is because the symptoms are usually silent at first, manifesting themselves in subtle ways such as fatigue, memory lapses, and mood swings. These signs are often confused with stress, aging, or simple tiredness. Another worrying factor is that the absorption of B12 can be compromised by various conditions, such as digestive problems, prolonged use of certain medications, and even restrictive diets, such as vegetarianism and veganism, which eliminate the main natural sources of this vitamin. Over time, untreated deficiency can cause severe damage to the nervous system and heart. The great danger is that many people only discover the problem when it has already become a real threat to health. Therefore, being aware of the signs and seeking preventive exams is essential. 8 urgent signs that your body is in need of more vitamin B12. 8. Extreme fatigue, tiredness, that does not go away can be a serious warning. Feeling tired from time to time is normal, but what about when this fatigue never goes away? When does getting out of bed feel like a daily battle, even after a good night's sleep? This may be one of the first signs that your body is suffering from a lack of vitamin B12. Vitamin B12 is essential for the production of red blood cells, which carry oxygen throughout the body. When B12 levels are low, the production of these globules decreases, reducing the amount of oxygen that reaches tissues and organs. The result? Your body goes into a state of constant exhaustion, as if it's running on reduced energy all the time. But this fatigue goes beyond simple tiredness. You may notice that you feel muscle weakness, have trouble performing simple tasks, and even feel your breathing shorter when making minimal efforts. Many people confuse this symptom with overwork or stress, postponing the search for a correct diagnosis. If you've been experiencing unexplained fatigue, even though you're sleeping well and eating well, it may be time to pay attention to your body's signals. And this is just one of the symptoms. The next one can directly affect your mental and emotional health. 7. Mood swings and depression, the silent disability that affects your mind. Have you been feeling anxiety for no apparent reason, sudden mood swings, or even symptoms of depression that seem to have come out of nowhere? Well, know that your mental health may be directly affected by a lack of vitamin B12. This vitamin plays a fundamental role in the brain as it participates in the production of neurotransmitters such as serotonin and dopamine, responsible for mood balance and emotional well-being. When B12 levels are low, the production of these substances decreases, leaving you more prone to irritability, anxiety, and even depression. The problem is that these symptoms are often confused with stress or common emotional problems. You can try to improve your mood with lifestyle changes, such as exercise and a balanced diet, but if the cause is B12 deficiency, these efforts may not be enough. Studies show that people with low levels of B12 have a higher risk of developing depression and other neurological disorders. In some cases, adequate supplementation can bring a significant improvement in mental well-being, but this must be done under medical guidance. If you've been experiencing persistent sadness, anxiety, or emotional swings without a clear explanation, it may be time to check your vitamin B12 levels. And it doesn't stop there. In addition to the impact on mood, this deficiency can also leave visible signs on your body. The next symptom may be reflected in the mirror. 6. Pale or yellowish skin. Your face may be revealing a serious problem. Have you ever looked in the mirror and noticed that your skin looked paler or yellower than usual? If so, this may be one of the most visible signs of a vitamin B12 deficiency. This is because B12 is essential for the production of healthy red blood cells. When the body does not receive enough of this vitamin, red blood cells become large and fragile, leading to a problem known as megaloblastic anemia. With fewer healthy cells circulating in the blood, the skin can lose its natural color, becoming paler. In addition, when these defective blood cells break down, they release a pigment called bilirubin, which can accumulate in the body and leave the skin and whites of the eyes with a yellowish tinge. This is the same effect seen in cases of jaundice, a condition usually associated with liver problems. Many people go months without noticing this change in their skin or attribute it to factors such as tiredness or lack of sun exposure. However, if you've noticed a persistent yellowish tint or unusual pallor, it could be a strong indication that your body is B12 deficient and needs attention. But the signs don't just appear on the skin. There's another symptom that may be inside your mouth and you may never have noticed. 5. Inflamed tongue and mouth sores, a warning that many people ignore. If your tongue feels redder, swollen, or even sore when touching certain foods, it could be that your body is trying to warn you about a vitamin B12 deficiency. This symptom is known as glossitis, an inflammation of the tongue that can leave it sensitive, shiny, and looking different than normal. The lack of B12 directly affects the production of red blood cells and the proper functioning of the tissues of the mouth. This can lead to atrophy of the taste buds, making the tongue appear smoother and more sensitive. Many people report a burning sensation or discomfort when eating acidic or spicy foods. In addition, a deficiency of this vitamin can also cause mouth sores, small cracks in the corners of the lips, and even painful ulcers. These signs are often ignored or attributed to stress and eating, but they can indicate a much deeper problem. If you've been experiencing discomfort when speaking, chewing, or even swallowing, and notice changes in the texture of your tongue, it may be a clear symptom that your vitamin B12 levels are suboptimal. But the effects of this deficiency do not stop there. The next symptom may be felt in your hands and feet, and it may be an even more worrying sign. 4. Tingling and numbness in the hands and feet. Is your nervous system at risk? Have you ever felt that nagging, tingling sensation as if needles were piercing your hands or feet? Or perhaps a type of unexplained numbness that seems to have no apparent reason? These signs can indicate something much more serious than a simple circulation problem. They can be a warning that your nervous system is being affected by vitamin B12 deficiency. Vitamin B12 is essential for the maintenance of the myelin sheath, a protective layer that surrounds the nerves and ensures that electrical signals are transmitted correctly throughout the body. When there is a deficiency of this vitamin, this protection begins to deteriorate, resulting in nerve damage and causing symptoms such as tingling, numbness, and even unexplained pain in the extremities of the body. Over time, if B12 deficiency is not treated, these symptoms can intensify and evolve into even more serious problems, such as loss of coordination, difficulty walking, and even impairment of mobility. In more advanced cases, the impairment of the nervous system can lead to muscle weakness and even atrophy of certain regions of the body. The worst thing is that many people ignore these signs, thinking that it is only a temporary discomfort. But the truth is, if you've been experiencing these symptoms frequently and without explanation, it's essential to investigate your B12 levels before the damage becomes irreversible. And the impact of a lack of vitamin B12 in the body does not stop there. It can even affect the functioning of your heart, and this next symptom can be one of the most dangerous. 3. Irregular heartbeat. What is a lack of B12 doing to your heart? Have you ever felt your heart beating too fast, skipping beats, or having an unexplained throbbing sensation? If so, it could be that your cardiovascular health is being harmed by a vitamin B12 deficiency. The lack of this vitamin affects the production of red blood cells, reducing the amount of oxygen that reaches the heart and other organs. In response, the heart tries to compensate for this deficit by pumping blood faster, which can lead to an increase in heart rate, also known as tachycardia. This extra strain on the heart can cause palpitations, dizziness, and even shortness of breath, especially after physical exertion. In addition, prolonged B12 deficiency can contribute to heart dilation and increase the risk of heart failure. This is because, without enough oxygenation, the heart muscle can weaken over time, making it difficult for it to function properly. Another worrying factor is that low levels of B12 can raise blood levels of homocysteine, an amino acid that, when in excess, is associated with a higher risk of cardiovascular diseases such as atherosclerosis and stroke. If you've been noticing irregular heartbeats, extreme fatigue, and frequent dizziness, it may be time to check your vitamin B12 levels before the problem affects your heart further. But the risks of disability don't just affect the heart. The next symptom can be even more worrisome, as it can compromise your memory and cognitive functions. 2. Memory loss and cognitive deficit, the disability that may be stealing your mind. Have you forgotten where you left your keys? Or maybe you're having trouble concentrating on simple tasks. If these memory lapses are becoming frequent, it could be that your vitamin B12 deficiency is affecting your brain in a more serious way than you might think. Vitamin B12 is essential for the health of the nervous system and brain, as it is directly involved in the formation of the myelin sheath, a protective layer that surrounds the nerves and ensures the efficient transmission of electrical impulses. When B12 levels are low, this protection wears off, resulting in cognitive problems like forgetfulness, brain fog, and difficulty concentrating. Studies suggest that B12 deficiency may even increase the risk of neurodegenerative diseases such as Alzheimer's. This is because the lack of this vitamin can lead to brain atrophy, reducing the volume of certain areas of the brain responsible for memory and logical reasoning. In older people, this deficiency can be confused with the first signs of dementia, which makes early detection of the problem even more important. However, the cognitive impacts of B12 deficiency are not unique to older adults. Young adults may also experience symptoms of brain fog, learning disabilities, and reduced daily productivity due to low brain energy caused by a lack of the vitamin. If you've noticed that you're forgetting things more often or feeling your mind slower and foggy, don't ignore these signs. Your memory and mental clarity may be impaired by B12 deficiency, and luckily, This is a problem that can be corrected. But the symptoms don't stop here. There are still other important signs that may indicate that your body is in dire need of more vitamin B12. 1. Other important symptoms you need to know about before it's too late. The signs of vitamin B12 deficiency go far beyond tiredness, mental confusion, and mood swings. Many people go years without realizing that they are suffering from this deficiency because the symptoms can be subtle at first. However, if left untreated, they can develop into more serious and debilitating problems. One of the lesser-known but equally worrying symptoms is shortness of breath and frequent dizziness. This happens because B12 deficiency impairs the production of red blood cells, reducing blood oxygenation. As a result, you may experience difficulty breathing after minor exertion or even sudden dizziness when standing up. Another important sign is blurry or impaired vision. A lack of vitamin B12 can damage the optic nerve, affecting communication between the eyes and the brain. In more advanced cases, this deficiency can lead to optic neuropathy, which causes gradual loss of vision. If you've noticed that your vision is getting worse for no apparent reason, it may be time to investigate your B12 levels. Additionally, some people with severe disabilities may experience changes in taste and loss of appetite. This is because B12 is critical for the proper functioning of the taste buds. Food may start to feel tasteless, which can lead to reduced appetite and, consequently, unintentional weight loss. Another symptom that is little talked about but very common is changes in thermal sensitivity. Some people with B12 deficiency report feeling colder than usual, even in hot environments. This can be the result of inadequate blood circulation caused by megaloblastic anemia, a problem directly linked to a lack of this vitamin. If you have been noticing any of these symptoms, it may be a sign that your body is crying out for help. But how to confirm if the lack of B12 is really the cause of these problems? In the next topic, you will find out which tests can diagnose this deficiency before it causes irreversible damage. What tests should I do to identify B12 deficiency? If you've been experiencing some of the symptoms we've mentioned so far, it's essential to investigate your vitamin B12 levels as soon as possible. Fortunately, there are simple and affordable tests that can detect this deficiency before it causes irreversible damage to your body. The first and most common is the blood test to measure vitamin B12 levels. This test evaluates the amount of the vitamin present in your body and can indicate if you are within the range considered healthy. However, even if your levels are at the lower limit of normal, you may still experience deficiency symptoms, especially if your body isn't absorbing the vitamin efficiently. Another important complementary test is the measurement of methylmalonic acid, MMA, in the blood or urine. This test is even more sensitive than the direct measurement of B12, because methylmalonic acid accumulates in the body when there is a deficiency of this vitamin. If your MMA levels are elevated, it's a strong indication that your body is suffering from low B12 levels. In addition, the homocysteine test may also be ordered. Homocysteine is an amino acid that relies on vitamin B12 to be metabolized correctly. When B12 is low, homocysteine levels increase, which may indicate a higher risk for cardiovascular and neurological problems. For people who have more advanced neurological symptoms, such as tingling, numbness, or memory loss, the doctor may order a detailed neurological examination, checking reflexes, coordination, and nerve response. In more severe cases, MRI scans may be used to assess whether there has been damage to the nervous system due to prolonged B12 deficiency. If you suspect that you may be deficient in this vitamin, it is essential to see a doctor and perform the appropriate tests. Catching the problem early can prevent serious complications and ensure that your body continues to function at its best. Now that you know how to identify B12 deficiency, it's time to find out how to prevent it and ensure that your health is always protected. How to avoid vitamin B12 deficiency and regain your health. The good news is that vitamin B12 deficiency can be prevented and, in most cases, reversed with the right strategies. It all starts with food and, if necessary, adequate supplementation. The first step is to ensure that you are consuming foods rich in vitamin B12. The main natural sources of this vitamin are of animal origin, such as red meat, liver, fish, eggs, dairy products, and seafood. If you eat a balanced diet and include these foods regularly, your chances of developing deficiency are lower. For those who follow a vegetarian or vegan diet, attention should be redoubled, as B12 is not found naturally in plant sources. In this case, the best alternative is to invest in fortified foods, such as vegetable milks and fortified cereals, in addition to considering vitamin B12 supplementation under medical guidance. Speaking of supplements, there are different forms of B12 available on the market, the most common being cyanocobalamin and methylcobalamin. Methylcobalamin is more bioavailable and efficiently absorbed by the body, especially in people with absorption difficulties. In addition to tablets and capsules, B12 can also be administered by injections, which are generally recommended for more severe cases of deficiency. Another important point is to ensure that your body is absorbing the vitamin correctly. Some health conditions, such as atrophic gastritis, celiac disease, irritable bowel syndrome, and long-term use of antacids or metformin, can interfere with B12 absorption. If you have any of these conditions, your doctor may recommend periodic checkups to monitor your vitamin levels and, if necessary, adjust your supplementation. In addition, maintaining a healthy lifestyle, including a good night's sleep, stress management, and regular physical activity, can help your body make better use of nutrients and avoid symptoms of fatigue and cognitive problems. If you want to keep your health up to date, preventing B12 deficiency should be a priority. Now that you know all the signs, impacts, and ways to prevent it, there's one last thing you need to know. Take care of your health. Your body is sending you a warning. Now that you know the signs that your body may be suffering from vitamin B12 deficiency, the big question is, will you ignore them or will you take action before it's too late? Many people spend years experiencing extreme tiredness, frequent forgetfulness, mood swings, and other symptoms without ever discovering the true cause. But now you have powerful knowledge in your hands. You know that vitamin B12 plays an essential role in your body, and that its lack can compromise your energy, your brain, and even your heart. The good news is that this deficiency can be corrected. With a balanced diet, preventive exams, and, if necessary, adequate supplementation, you can regain your vitality, mental clarity, and overall well-being. But this will only be possible if you take the first step. Pay attention to the signs and seek medical advice whenever necessary. Don't ignore the warnings your body is giving you. Prioritize your health today to ensure a long, healthy, and energetic life. If this content was useful to you, share this knowledge with more people. After all, many people may be suffering from the symptoms of B12 deficiency without even realizing it. And now you know what to do to avoid it. Take care. Your future will thank you.